Let's talk about something that affects 10% of women globally. My name is Dr. Raj Arora. I'm a GP, and let's talk about endometriosis. Endometriosis affects 1 in 10 women, and those assigned female at birth. That's 1.5 million women in the UK. So what is endometriosis? Endometriosis is when the tissue that lines the inside of your uterus grows outside the uterus. This could be your fallopian tubes, your bowel, and other organs. Now, endometriosis is often mistaken for other conditions, and one of those conditions is adenomyosis, and this presents similarly, but the main difference is where the tissue grows. So as mentioned, in endometriosis, the tissue grows outside of the uterus, whereas with adenomyosis, the tissue grows inside the uterine muscle. Now, these conditions can often occur together or separately, and this is where sometimes there's a bit of confusion when trying to get a diagnosis. Now, both adenomyosis and endometriosis have some common symptoms. These include pelvic pain, irregular periods or heavy periods, and also trouble conceiving. Endometriosis can lead to scarring, and this can lead to bowel dysfunction as well. So there are some differing symptoms between the two. So what are the causes? Now, it's not fully understood what causes either endometriosis or adenomyosis, but with endometriosis, it's thought that something called retrograde menstruation, which basically means that when you're having your period, the blood's flowing back into fallopian tubes, into other areas of the organs and causing scarring. Adenomyosis, on the other hand, is thought to be caused by a disruption of the boundary between the uterine muscle and the deepest layer of the uterine lining, so the womb lining. So two of the common complications of both conditions include anemia from chronic heavy periods and also infertility or subfertility, so trouble conceiving, and this could be because of scar tissue from endometriosis or trouble implanting, which is normally more common with adenomyosis. So how can we treat these conditions? Well, there are some common treatments that we can use for both conditions, and these include pain medications to regulate the painful periods and also medications to help with heavy flow as well. We can also use hormone medication to help prevent you from having regular periods and therefore preventing scarring from endometriosis, for example. But the sure treatment normally is surgery, and that's for both endometriosis and adenomyosis. Both conditions are chronic and can affect women from all social and ethnic backgrounds. So if you have any of the symptoms that I've mentioned today, please go and see your GP, and there is definitely help available. So that was a quick overview. If you have any questions related to these conditions, please pop them in the comment section below and I'll try and answer them for you later.